Yes.
Yeah, ma'am, I'm ready.
Right. So considering its surgical pathology station, what is your provisional diagnosis?
Its diagnosis is carcinoid syndrome due to carcinoid tumor.
All right. How would you go about and confirm your diagnosis more than what has already been done?
We can go for blood test, look for the chromogranin A. We
Okay.
can also do 24-hour 5-hydroxyindole acid, and we can do
This has been
immunohistochemistry.
done. Yes.
Yeah,
Okay.
we can also go for immunohistochemistry for chromogranin B,
Yes.
and we can go for CRP, ESR, and white blood cell count.
Okay. Right. Right. Please tell me what treatment can you suggest for this patient?
This patient, we can first of all give fluid therapy, then antihistamine, and we can give her a bronchodilator for bronchoconstriction, and also can give antibiotics if there
Okay.
is the patient is having superadded infection, and do the CT abdomen to locate the tumor, and if we can excise it, that would treat the syndrome.
Okay. What my okay, right. Okay. All right. Can you please tell me what is the pathogenesis behind this patient's condition?
Uh, uh, these are due to the neuroendocrine tumors arising from the enterochromaffin cells of the neuroendocrine system. So most of these tumors arise from the small intestine and can also arise from the tip of the appendix, rectum, stomach, and lung.
Okay. What measures one can take in order to, so if these are, do you think the one of the cause of this condition could be hereditary?
Uh, I don't think so. Most of these are developed later in ages. It's not hereditary.
Okay. Would you be
Most of
able
the
to,
time,
yes,
yes,
look at the
carcinoid.
image
Yes, ma'am.
and please explain what are you looking at?
This is histological slides. On A, there are there on the outside. There is basement membrane. Then inside there are epithelial cells, and there are few enlargement, or you can say deformed enterochromaffin cells inside uh, the slide
Okay,
in the
what are
center
the
part.
common conditions where would you find this kind of carcinoid tumor?
Uh, it is found mostly in the if patient has acute appendicitis previously, and if there is any infestation by Entobius vermicularis tapeworm, or patient has any symptoms of intermittent abdominal pain with flushing, or valvular heart disease, or fibrosis of pericardium, or if there is any, as this patient has bronchial constriction or asthma like symptoms, we can suspect the patient to have carcinoid syndrome.
How would you say that carcinoid tumors are benign or malignant?
By doing the histopathology, we can
Yes,
know if they are benign or malignant.
yes.
If there is involvement, if the tumor is invading the nearby structures, or if there is more pleioformism, more nuclear to cytoplasmic ratio is increased, or if there is lymph node involvement or metastasis, we can suspect that patient is having malignant carcinoid tumor as compared to the benign.
All right. If considering that patient could have malignant part as well, how would you comment on the prognosis of the condition?
Malignant cancer, if it has metastasized, 5 year survival is only 25%. So
Okay.
the prognosis is bad in the malignant cases, but if it is only localized to the appendicular tip, and if it is less than 2 centimeter, the appendicectomy would cure it. But if
Uh,
it,
with
yes,
me, I can see that 5 years survival is 70%.
ma'am, I looked into Bailey and Love, uh,
Okay.
and I
Bailey and Love is old, not a new,
then I,
new or recent. Okay. Anyway, right. How should a patient with malignant type of carcinoid tumor should be treated?
we can go for appendicectomy. And if the tumor is more than 2 centimeter, we can also go for right hemicolectomy and lymph node dissection along with ileocholic anastomosis. And post-op, we can go for chemo or radiotherapy.
Okay. So this in front of you image is A, B, C, and D. Right. They're all four or of carcinoid tumor, but they're all four look different. In C, there is arrow showing something, and in D, arrow is also showing the same thing. Would you be able to identify what this arrow is pointing at?
I don't know, ma'am.
Okay, what kind of cytoplasm are you looking at? Would you be able to comment?
Yes, cytoplasm is central, the pink part in this.
Yes, it's eosinophilic. And nuclei are round and oval. Anything else? Do you see rounded cells, rounded and oval? See all of them? What
Yes,
more?
there
Why is
are.
this chocolate color, or if you could comment on it?
There is more chromatism. The nuclear chromatin is more darkened. That
Yes.
shows that patient is having a poor differentiation of
Okay.
the epithelial lining or the nuclear matter inside the nucleus.
Could that be because these are taken from different parts of the body? Because this
Yes.
one is taken from gastrointestinal, see the
Okay.
goblet cells kind of thing. And if you could look at, how would you comment on this? What does it look? Okay.
Here, more these cells look more elongated as compared to the one that we saw in A.
Previous one, yes. Okay. Neuroendocrine tumors. Good. Thank you.
Thank you, ma'am.